like I said before, they've deployed a website. We have serious concerns with that. We've highlighted some of the issues that we had with performance, functionality, deployment, so on and so forth. So, like I said, we have concerns with what's happened with the CGI, and like I said, we're going to be talking to the board in about a month about our plan of action.
The system that's built can support things to a certain extent. We talked about that particularly with the non-subsidized applicants, the people who today, as you know, can go end to end and they can submit their electronic funds transfer payment, and those people, as I mentioned, will have their coverage access for 1/1. There are pieces of work that we have to do outside of the system, and that we've actually been working with our customer service and business operations vendor, Dell, to actually support, and that's in sending out the invoices and sending information to our carriers outside of the system, and we've worked with the carriers to do that. So in large part, I'd say the system supports the non-subsidized population, obviously acknowledging that that system has been finicky for people applying to date. We know that. We've certainly heard that. Putting that group aside, for the subsidized population, we do rely on the system to an extent. As we said, the population is applying through the system. The online application process is new for this population. That is actually a big advantage of what we've been able to do. The challenge is they get through that process. A lot of the information that the system spits out is good, and we can process it in our own outside system, in the tools that we've created to automate a determination, again, outside of the system. So without the system, we couldn't have done that. But because of the system, we do have some data challenges that mean that we might not necessarily be able to automate them through the rules engine that we built separately. So it's kind of a blend of pieces that we've built ourselves and have had to work to do that, married with what we've been able to leverage from the system as it stands today.